From here, we're going to go to yet another doctor, this time a pulmonary medicine specialist, also a specialist in intensive care, is a principal partner at Long Consultants Company in Nashville, Tennessee, in the United States, Dr. Olushola Ogutolu. Good evening, Dr. Ogutolu, and thank you so much for your time. Thank you for joining us.
Good evening. Thank you for having me.
Dr. Ogutolu, if you can hear me, how is the United States dealing with the challenge of the hospitality industry in this COVID era?
As you all know, if you can hear me clearly, this has been a profound public health event. It's of epic proportions that has touched every corner of the globe. Pretty much every continent except Antarctica has been affected. It has instigated not just fear, but in the United States, there has, after an initial shell-shocked reaction, we have been able to respond. Both the government and the private entities have gathered or marshaled their resources to confront it. Specific to hospitals and the hospitality industry, there has been both predominantly a government response, both in getting education out, creating awareness. The Center for Disease Control, the National Institutes of Health, and other such government parastatals have really gone into overdrive. Other aspects of the government have encouraged tremendous ramping up of testing. Now, I cannot emphasize that enough. You cannot identify cases, isolate them, track them, treat them, if you cannot test them. So this is really, really critical. And beyond that, there has been a lot of financial incentives and programs put in place to support pretty much every industry, but particularly the hospital system, the healthcare system, and the hospitality industry.
Now, I guess the hospitality industry would also include some of what we were looking at there, bars, restaurants, and hotels, and so on. Now, my question basically was, how are they coping? Because with all the guidelines and with all the rules that are now in place in the COVID era, all the things that people normally go to all those places for are now not quite acceptable.
So the world is going to change as we know it. The previous guest alluded to some of the things that have changed and will have to continue to change. Pretty much like what happened after 9/11. You go to an airport now, you know the protocols and procedures we have to go through. Much the same thing is going to have to happen here. A lot of it is still being worked out. We're in the active process of actually understanding what this is about. So everything from social isolation or social distancing, contactless protocols, minimizing the number of people that can be within any enclosure, and remote working if it's possible. And in the hospitality industry, obviously, you can't have an industry when people can't be there. But a lot of those mitigating protocols have been put in place. Now, all that is post the lockdown period. So a lot of cities on a rolling basis are starting to slowly reopen. There's not a unified strategy just yet. Again, all this is being worked out, but at the bottom of it all is the need to test, to identify, and to separate people who are at risk and people who have been infected from the healthy workforce.
You're a pulmonary medicine specialist, and I wonder what would be your own particular concerns with, in terms of health risks with this industry that we're discussing today.
So, specific to pulmonary disease, my specialty, and as it pertains to the lungs or lung health, a lot of what COVID does impact most other systems of the body. In fact, it affects everything from your nose to your toenail and everything in between. However, your lungs are probably they have the most contact with the outside world. We breathe all the time. So we're all connected and exposed to each other. So there have to be mitigating strategies in place, principle of which is to prevent people who are infected from dispersing the germ and also for people around who are not already infected from catching it. I'm talking about masks. It is fundamental. It is absolutely fundamental. Also, something as basic as hand washing is foundational. It is critical. Beyond that, there's not a whole lot individuals can do per se, but the entities that run those establishments, like I said, have to really invest and educate in disinfection, deep cleaning, like we said. They may have to reorganize the layout, the workflow of the establishment, and also, as much as possible, have contactless protocols. There have to be more frequent washing of surfaces, including beddings. And people who have existing lung disease ideally should avoid as much as possible external exposure. But to the extent that they have to engage, it is critical that they protect themselves, primarily hand washing, wearing masks, and keeping adequate distance between them and anyone else out there.
Dr. Ogutolu, thank you so much for your time. Dr. Ogutolu joined us from Nashville in Tennessee. It was our pleasure to have you on the program this evening. Thank you so much for your time.
Thank you.